Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and you have joined us, tuned into our series In the Know, where we make it simple. And today we're simplifying prioritization. Prioritization questions are higher level questions that require you to know your content in order to answer them. Prioritization relates to either who the nurse sees first or what the nurse does first.
And these are super difficult questions for a lot of students because a lot of students think it always comes down to two correct answers. And that's not always true. Now, how can you recognize maybe you're facing a prioritization question? There's some keywords, so we're going to talk a little bit about that first. Some keywords might be best. So in the stem or the body of the question, it will say, what is the best action of the nurse? Immediate, what is the immediate action of the nurse? Or what should the nurse do immediately? Essential is another key word that's often used in those types of questions. What would be essential teaching or essential action on behalf of the nurse? First or next? What would the nurse do first? Who would the nurse assess first? Or who would the nurse see or assess next? Most likely, what would the nurse most likely say or most likely do or most likely see? As well as initial, which is basically code word for first, right? What would be the initial response, initial action, or initial assessment of the nurse? All of these things kind of give away that this is a prioritization, high-level question requiring a lot of critical thinking. Now, in prioritization questions, it is not unlikely that all four options will be right answers. But the nurse's job, right, or the student's job, the person writing the exam's job, is to come up with which one is a priority among the correct answers. So it's not incorrect that you read the options to the question and you think, well, I would do all of these things. Yes, you might do all of those things. You might assess all of those patients, but the key is which one would you do first? They're all correct. Who would you see first, right? That's what we're getting at. So we're going to simplify that for you.
And there's no tricks to getting to the right answer when it comes to prioritization questions. The process that you have to undertake is studying. You have to study, okay? You can't wing these registration exams. Please study. You need to know your content in order to get to the answer when it's a prioritization question. It's very high level. So we're gonna consider this as Ashley draws on our board here, that when you're faced with these questions, how are you going to tackle them? Well, let's simplify an approach, and this approach is relating to who does the nurse see first. So non-priority patients versus priority patients would be test questions that often make stable patients sound unstable. So an example of this would be a patient who has COPD and diabetes and hypertension. So that sounds really unstable. But we know many people that are walking around malls and supermarkets right now that have comorbidities such as these. So don't let that trick you when you have a question and one of the options in the answer has something with many, many things going wrong. Expected versus unexpected. So test questions will often make expected findings sound catastrophic to try to trick you. So for instance, COPD has an O2 saturation of 88%. Well, that would be an expected finding versus a person with no respiratory disease who has a dropping O2 saturation, right? That would be unexpected. Another example would be chronic versus acute. So a test question will often make a chronic condition sound worse than it actually is. So for example, if you had a patient with a diagnosis of congestive heart failure, you would expect that they would have peripheral edema and fluid retention possibly as a symptom of their chronic congestive heart failure. Whereas if it was an acute, say, catastrophic cardiac event in the heart, then we would start to see peripheral edema as a symptom of this acute episode of congestive heart failure. So not to let that confuse you related to what is the priority there. And then potential versus real. So test questions will often make potential problems sound really scary. So an example would be a post-op day 1 patient. They have the potential to become a real problem, but if it's not indicated, then it doesn't make them a priority just because they're post-op. Okay? So potential versus real.
So this is what you can use to help you come to the right answer in terms of who does the nurse see first when you're given a series of the nurse has these 4 patients in the assignment, which patient should the nurse assess first? Also consider when we're talking about what does the nurse do first, there's kind of 3 things that you can use to decide above and beyond your content knowledge, which is most important, in terms of what the nurse would do first. One of those things would be relying on Maslow's hierarchy of needs, which is that triangle, right, that has 1, 2, 3, 4, 5 different levels. The lowest level, which is the very first thing of the utmost importance, is basically physiological. Okay, that means basically the ABCs, airways, breathing, and circulation. The second level is protection. And when we consider this in terms of nursing interventions, we're talking about protecting the patient from injury. These 3 higher levels don't really come into play when it comes to prioritization questions. So you need to know about levels 1 and levels 2. Now, level 1 is actually the next thing you can use to come to the correct answer, which is the ABCs. Every nursing graduate knows the ABCs, the airway, the breathing, and the circulation, which is fantastic. We prioritize the airway. However, there's a disclaimer to using the ABCs. One thing, a mistake that students often make or graduates often make, is they see an airway as an option for the correct answer and they automatically choose, oh, airway. It's always ABC, so I'm going to choose the airway option. However, if the stem of the question or the patient's problem has nothing to do with the airway, if you just use the ABCs without incorporating critical thinking, it will cause you to choose the wrong answer. And this is why we say there is no trick to this, okay? The third is using the nursing process. And we all know that the nursing process is ADPI. That's what we know it by, which stands for Assessment, Diagnosis, Planning, Implementation, and Evaluation. Basically, though, we're only going to take into consideration the assessment part. Because usually, in terms of prioritizing questions, if assessment is an option, meaning the nurse would further assess this prior to doing this, it's almost always the right answer to assess first. Now, there's a disclaimer to following the nursing process, and that is, an example, if there's a life-threatening event that's taking place, you wouldn't assess prior to doing an intervention because then you're placing the patient at harm or at risk. An example might be if there's an internal hemorrhage going on and the 2 symptoms that combine to notify the nurse in terms of knowing your content of a possible internal hemorrhage might be a lowered blood pressure combined with tachycardia or an elevated pulse. So you know that content, it brings you to thinking, oh, this is likely an internal hemorrhage, this is an emergency. In that situation, you would not assess the source of the bleeding prior to putting fluids into the patient's body, right? Because the patient's in a life-threatening situation. So these 3 things here can help you decide what to do first, also over and above knowing your core content.
So for this and more, please look at our complete study package. And within our complete study package, we have a section specifically on prioritization that you would be interested. See you next time in the know.
Bye for now.
Bye for now.